Hi guys, today is June 24th, 2020. I am here today with Dr. Michael and Krista Kim, and we are going to give you an update about where we're at with the coronavirus here at Sky Valley in Caliente, as well as the surrounding valley that we all have a nexus to. And so let me just ask a broad question to start, and that is, where are we at today?
Well, since Memorial Day, we've seen a bit of an upturn in the number of cases throughout the Coachella Valley and Riverside. And so, in the last couple of weeks, what we've seen is the increase in cases that has been fairly dramatic. We've also seen an increase in testing. So, by its nature, when you test more people, you're going to find more cases. So we've gone from a percent positivity rate down around 7% of our tests were coming out positive to now we're over 10% of our cases, our tests are showing up positive. This is really concerning, and one, because it means that we actually have more cases, but the second reason it's concerning is that's over that threshold that the state set for moving forward with opening. For that slight increase, we should be paying attention. We should not panic. What we also need to keep an eye on is our hospitalization rate. So at Eisenhower, what we see is that the COVID-19 hospitalizations have gone up from our baseline of about 20 patients in the hospital closer to the 50 range. So we still have ICU beds, we still have hospital beds, but the trend is concerning. And so there is an increased push from public health agencies to remind people to be alert and take precautions.
But the good news is that Sky Valley has such a low number that when you come back home, it is a safer place because there's not a lot of people milling about that we know that are positive within Sky Valley itself. So even though we're all connected, it is, if I had a place to live, to pick, probably the places where there are less positivity in there, even though we're related in terms of where you go.
In general, we know that places with lower population densities have lower transmission rates. That means if you're all crowded onto public transportation and then living in a crowded apartment in a crowded building, it's easier to spread it quickly. So when you're spread out more, you're naturally socially distanced. I assume every single person I come into contact could have it, and I behave accordingly.
Yep.
I assume I could have it, and I wear my mask to protect others. So if you just treat everyone the same, like we all potentially could have it, you'll just always do the right thing. And that one time where you actually came in contact with someone who was positive, you don't have to worry because you did the right thing.
And I would say there's good data, good news coming out. There's good medicines that's very promising. The vaccines are in their trials where they're really moving along. They're getting close to manufacturing them.
We're really looking at probably another 6 months of this, but there is an end. So hang in there.
Right.
6 months of the really focusing on the social distancing and the masks. Basically, we're out of this if we get a good vaccine.
Yeah.
And it looks like possibly the beginning of the year is looking still likely that
You think the
would
ball
happen.
game in town is vaccine. Then we can go back to the normal life of hugs every day
Right.
and high fives.
Exactly.
At that point. Yeah.
We're at the point of people are looking to go on vacation, whether you come here or go somewhere else, and just be, just know the data where you're going in terms of, am I going to a place that's safer in terms of their numbers, or are they climbing? Bring your masks, not just one. We talked about having at least 4 or 5 so you can wash. Bringing enough medication that, just the basic things when you're going. And if you have an insurance policy, calling them and saying, hey, what do I do if I get sick there and what happens? Just so you know. But most cities have testing in places that you can go. So
I also think it's probably, as people are planning vacations, good to think about where you go as far as what will it require in contact with other people. So I think a lot of people are looking for places where they're going to be able to stay somewhere, make their own meals, have access to facilities, but not have to contact dozens of people a day.
Okay, that's all for today, guys. Thank you very much
Bye.
for coming.